Thanks for joining us. This is the session on, are you getting the most out of your EVV system? You know, we have all been required under federal law to be using EVV. Many folks were using EVV prior to being required under federal law. But there are differences in different systems, and there, you know, just like all of the $1,000 phones that we carry around in our pocket, I am willing to bet that these systems do any number of things that we don't realize they do, and we are not taking advantage of. And so we are fortunate to have three wonderful experts here, and I will allow them the opportunity to introduce themselves, but welcome, thanks for joining. And yeah.
Hello, everyone. Brian Perry with Direct Care Innovations. I'm the Vice President of Sales, and we're happy to be here and looking forward to today's session.
Jared Schneider, CEO of CareTime. We're a software for FIs and agencies, and glad to be here.
Good morning, all. Great to be here. John Pandolfi, Vice President, Client Solutions for HHA Exchange. I work where the market meets our software for FIs and LICSs in New York.
Slightly awkward. We have 3 mics and 4 people, so I'm just gonna, we're flexible. So I think it makes sense, as I said, kind of opening this up, right? The elephant in the room, EVV has been somewhat controversial amongst a group, and some consumers, PAs and FIs have decried the new system. There's many FIs who have been using different EVV systems for a decade or more. And the reality is somewhat in the direction the world is heading, with or without the mandate, EVV was going to become the reality. Technology and the efficiency that is demanded makes the technology necessary. It can streamline operations, lower costs in a way that doesn't just benefit agencies, but can benefit consumers and workers themselves. But, you know, there's, as a former boss of mine used to say, this is America. If you tell people they can have ice cream every night, they will love you. If you tell people they must have ice cream every night, they will hate you. And so, you know, given that, and given the fact that it will take an act of Congress to overturn the requirement for EVV, and even if that occurred, the efficiencies it offers means that almost every agency would retain the system anyway. It does beg a number of questions, and I'm just going to throw all of these at you at once, and y'all can just go. So hopefully you can remember them. Well, I can refresh your memory if not. But you know, how can FIs work with you all and other EVV vendors, their consumers, and the PAs to accurately address both the pros and cons of these systems? And how can they demonstrate that instead of being invasive, the systems represent an opportunity for greater choice, freedom, and empowerment, consistent with the philosophical underpinnings of CDPA, where the consumer is in charge? What steps can they take to work with consumers to answer questions and address concerns, particularly now that the systems have all been rolled out and are in place? And that's all the questions I'm wrapping into this one.
So I guess I'll take a step backwards and say that since 1/1 post-CARES Act in New York, when things became officially required, the biggest thing that I've seen since then, the biggest gap in everyone's understanding, before we get to how you work with your software vendors or EV providers, is with the state aggregation. I really wanted to emphasize that today. You know, there's 2 components to EVV in my eyes. There's collecting it, right? And we'll debate collecting it and how to collect it, the best manners to collect it. But then there's ensuring that it goes to the aggregator. DOH and General Dynamics are the state aggregator for New York, and they've put together specs on how they want to receive your EVV data. And so, to me, you need to have a fundamental understanding of that process and how it works to make sure that the stuff you're collecting is actually going where it needs to go. And in these last 10, 11 months, as I've been speaking to FIs and LICs, that is the biggest gap in everyone's understanding. They're good with collecting by and large. They understand how to collect and the means in which they can collect it, but they don't understand how is it going where it needs to go. Because right now, we understand that no one at the state level, at least from our intelligence, is matching up EV data with claim data. But we expect that to be the case in the very near term, midterm, long term, right? We don't know exactly when, but that they wouldn't collect it for the heck of it. We hope they wouldn't. But so make sure you understand the pieces of data that are going to the aggregator, how and when they're going to the aggregator, and that you know they've been accepted by the aggregator. We've sent millions of records to the aggregator. We're at about 85% acceptance. So if I collect 100 EVV visits and only 85 go to the state, there's 15 that I'm not getting credit for. So when the time comes and someone's looking to reconcile your claims with your EVV, make sure they have 100%. So that was my first opening comment.
Yeah, and I'll jump in a little bit. I think just conceptually, the EVV mandate was not really designed with consumer direction in mind, and I think a lot of this audience knows that. And so there's been more pushback from a community like this than in a traditional agency model. And fundamentally, the mandate was created to keep agencies from fraudulently billing. Now that can happen with a consumer and PA situation, but by and large, it doesn't happen to the same degree. And so it's all kind of getting wrapped up in the same mandate. And so what you have to look at, and I'll kind of address the collection piece. What you have to look at when you're evaluating, the pros and cons is, are there tools in place with whoever I'm using, whatever vendor or whatever system I plan to use, are there tools in place to address the needs of my consumers and PAs? And that could be multiple EVV methods. It could be a workflow thing. I think when you talk about the pros of having a system in place, I think it helps to explain to, the consumers and PAs, if they're not involved with the FI, is literally there's someone taking in your paper timesheets and punching them into the system to make sure that you're getting paid and that the money is coming in for that. So you kind of eliminate that whole situation by doing that. So it's kind of boosting your accuracy in payroll. And yes, there are things like edits that have to take place, and there's hiccups along the way, but generally it should make the whole process more efficient, and that your payroll is going out to the PA more efficiently as well.
Perfect. I agree with what both of you are saying. I mean, taking the words out of my mouth in some respects, but we're all about choice and freedom. We started in this industry dealing with FIs all across the country, and you have to have multiple methods to be able to collect that EVV. You have to be able to make sure that the methods that you're using suit the consumer and their PA, right? It's not fair to ask someone with dexterity issues to sign a signature pad or to type in their PIN or password. You need other methods. So it's all about making sure whatever system you choose, that you have those methods available that meet your consumers' needs, that their PCA can, work with. At the same time, there's a lot of other benefits that you can gain from these systems that gives visibility for the consumer to be able to see their authorization, their utilization, what their budget is, that they didn't have before. If you're on paper timesheets, how do you know where your budget was? How do you know how much time you have left? So now, as the consumer who's directing my own care, I know where those things are. I can make sure that I'm getting the most care that I'm given. And I also get the metrics to say, here's what else I need. And we have definitive data that we can back it up with. So I think all those things are important. And, that all goes to aggregation, to utilization, and to the use of the system.
That's interesting. What I really heard there was it's all about the data from both ends, from making getting your claims data right and making sure that it's all going into the aggregator so that when the auditors come to look, your records are matching up and you're getting reimbursed for everything all the way along the line is always the important part. But also, letting the consumers know how they can utilize the data to improve their services, improve what they're seeing, and really moving throughout and building methods that support your consumers and making sure that you're using your EVV system to support your consumers. And I think, one thing that's great about all three of these vendors, there are other vendors that have done this, but, said that this was not something that was built with consumer direction in mind, right? And so many tried to just shoehorn systems for consumer directed into their existing home care system. And, systems that have consumer direction at the heart and are tailored to this model really do an amazing job. And so, we are always thrilled to have partners that do that. And I would say making those pieces. Now, John, you had spoke to data aggregation, and I think, that begins to get to this notion of best practices. How do FIs work to make sure that as they're moving forward with these EVV systems, they are incorporating them based upon best practices? Some of the practices involve training PAs and consumers on the system and making sure that they know the basics of what the system is and how it works. That's required by law. Hopefully folks have done that. However, as is always the case, many best practices aren't defined in the law or regulation or the like. They're just, they are systemic best practices that we should do, and some do and some don't. What would y'all say are some of those best practices that FI should incorporate into their research, implementation, or ongoing usage of an EVV system to ensure that their consumers, the consumers' PAs are getting the most out of that EVV system?
I'd say a couple things. First is not to get stuck in a rut where I'm going to focus and hone in on one method of EVV and kind of stick to it, hell or high water, right? We think there's multiple methods of EVV, whether it's IVR, telephony, where you pick up the home phone and dial a number, or the caregiver uses his or her phone and uses a fob device, or a mobile app for GPS technology. You can clock in with one, clock out with the other, clock in one way one day, out, or clock in and out another way the next day. So employ a model where you give your consumer and the PA the ability to choose what they're comfortable with. We all know that some people do not want you to touch their phone. They don't have a phone. They feel like you're tracking them with GPS. There's a lot of misnomers, fear, anxiety about EVV. So employ the method that makes your participants comfortable. And then secondly, in terms of best practice, use one that will work when you don't have service, Wi-Fi, or in some sort of emergency situation, because the state's made it quite clear that it's not a good enough excuse to say you didn't have a connection. So use a method that employs offline capabilities so you can collect the EVV and sync it back to where it needs to go at a later time when you regain some sort of connection.
Totally agree with all that, John.
Mm-hmm.
So I think some other great best practices are quick start guides, right? Have some documentation that you can put in front of the consumer that they have at their disposal. So when their PA is having trouble, struggling, here's a quick little thing. Have ongoing trainings that are live and recorded so folks can jump on and ask questions. It's all about education, about getting the folks the information they need when they need it, and having the support in place so when they're struggling they can call, because that's what we see the most. It's I can't log in because I forgot my password, or I did this or I did that. We get those little 2-second phone calls that can be resolved or that could have been resolved if they had a quick start guide in front of them. So what can you do to enable the consumer and their PAs to be able to solve their own problems, reduce phone calls to your office, and give them just a better experience? Because frankly, it's all about experience at this point. You know, if people struggle to use the app, if it's difficult, they're not going to do it. I mean, you're low paid folks, unfortunately, that are the PAs. So they may not have the smartphone. So just as John said, you have to have other options, have telephony, have fob devices. So have all these different options that are available so that you can meet the needs of your, audience that you're dealing with.
Yeah, and I think your point to, having the quick start guides and having training available, all of those things. And then what we've seen FIs really thrive with is when they get with our, implementation folks and they really learn the system in and out. And then you kind of assign either a point person or point people within the FI itself to be kind of the first line of defense, especially when it comes to consumer and PA questions. They can show that, live data. They can be like, hey, let me show you what my portal looks like or what my system looks like or how I do this. And they can just show them real quick. And it's like boots on the ground, which is great because, for us to kind of go through 2 layers of people, we're happy to help, but it really, really helps speed things up as far as adoption when you have someone at the FI that is kind of the champion and the point person for it.
Yeah, that's an excellent point. You stole it out of my mouth. It's that the coordinators or the point people have the most direct influence on your PAs and consumers. And you can, in our experience, you can train the PAs as much as you want about it, but if it's not being reinforced by the agency, the FI, and the coordination staff, I know coordination is a bit of a loose term in the FI world, but they are the ones that drive it home and can monitor it on the ground level.
Yeah, and just to kind of give a picture of like the adoption difference is, and it may be population and location and things, but we've had some FIs where, they have like 70% adoption initially. And then when we have that kind of train the trainer situation where we have advocates in the system, we've seen 98% adoption. So it greatly improves the whole situation when you have someone on the team able to help and train.
Yeah, and language capabilities, right? The variety and depth and breadth of languages spoken in New York and other states is obviously phenomenal. So making sure that all the tools that the consumers and PAs are interacting with are in their native tongue, right? And that they're translated correctly. That's super important.
Totally agree. Yeah, if you don't have multiple languages, you're going to run into difficulties. So you have to have all that options available.
I think what I heard repeatedly, just in different forms and different fashions, there was something that I come back to repeatedly as I'm talking to FIs, which is, hey folks, you're running a business. The consumers are your customers. And at the end of the day, it is about customer support and customer satisfaction and making sure that you are doing what's necessary to communicate with your customers in a way that they can hear and understand. And that is true regardless of whether we're talking about EVV or wages or the hiring and onboarding process or any aspect of the system.
Well, to that point, Brian, from a national level, the FIs we work with, the most successful ones, take a customer first approach. So if you aren't, getting out there frontline support, having someone that your, attendants can call, someone that your consumers can call, know on a first name basis. If you don't have that, you're losing folks and you're losing their patience and their thoughts. So it's really important to have that frontline customer service that is exemplary. And if you have that, we've seen FIs across the country take off like rocket ships. So it's always crazy to see market share that can be gained, and as well as just the satisfaction that the consumers and their PAs get out of that. They're self-directing their own service. They want to take that control, but they need that help and assistance to guide them down the correct path.
Yeah, it really does come down to, it is It is the way we interact with the folks who are working with us in every single area. And, I think coming back, this kind of merges both of the themes from the first two questions. There's best practices, there's customer support, there's data. And when we look at all of this really gets to one of the sessions that we held yesterday, which is this notion of value-based purchasing, right? And value-based purchasing is going to rely first and foremost on data. If you can't prove that what you're doing is working, you have nothing to contract with. You have no way to arrive at these agreements. So I'm curious about your perceptions of how EVV can foster these value-based agreements and simultaneously maintain the consumer's role as the employer responsible for training, scheduling, and supervising, while also helping convey information that could strengthen the service overall. And I think convey information to the FI and convey information to the consumer, as had previously been said. Jared, I'll start with you this time.
Yeah, well, I think when talking about the value-based purchasing side, it's very difficult as you get down into the home care level, because you're not necessarily, like, the metrics aren't medical related, and it's not charting, and your metrics to measure that are very limited, because and it goes back to that data and making sure that someone who's authorized for that care is getting that care and continuously getting it. And so that's kind of what, I guess if you were to come full circle of like the benefit of EVV is that's providing that data. And then that's proof point for you to go when it comes time to contract. That's your data to look at. Now, I don't know if they're going to start incorporating, down the road, other types of metrics and things like that. But again, it's difficult because it's not a medical level situation where you have, all these different aspects to look at. But that data is going to be critically important.
Yeah, so we look at EVV as the conduit for exchanging information aside from just punching in and punching out, right? It's kind of forced technology into the home, and we know that it's forced PAs to interact with that technology at least twice, right? On the in and the out. And so I've got to do something. And when I do those two things, in addition to saying I'm starting and I'm stopping, I'm in a leveraged position to say other things. The patient's, the consumer's condition is different today than it was yesterday. They fell today. They were confused today. It appears they're gaining weight, they're losing weight. So through that conduit, it's really the perfect avenue without having to introduce any more technology, which folks are trying to do. But to keep it simple, why not piggyback off of the EVV tools that you're using to convey this other information that really provides change in condition information? That is the underpinning of, I think, what value-based care is getting at. There's so many tools out there that in a very easy manner, a PA who's already responsible for a lot of things, right? To kind of make one point, you don't want the PA to feel like now they're a nurse that is responsible for taking blood pressure or doing all this advanced clinical things, but you want to allow them simple questions with powerful meaning behind them. And so simple, easy to answer questions, yes or no questions that can be responded to during the EV process, we feel like is the best way to accomplish VBC in the home.
Totally agree. And we're seeing it in other states across the country where they're starting to require tasks and things like that. But, the EVV is the lens or the way that we're going to get this data to the state, to the organizations, so that you can then, back up what you need to get your contracts. What we're seeing now is if people can get past the whole mandate, as Brian put it, no one wants to be told what to do, but we have this powerful tool that we're putting in front of folks that we can take away these antiquated methods that they're using to gather information via paper, via, charting that way of capturing the tasks, of capturing incident reports, of capturing all this information. We have a tool that's at their disposal in their hand that frankly is quicker and easier to use than those paper forms. I liken it to when people start filling out paper forms, fill out their time card and they want to tell me that that's faster. I pull up my app and I say, I'll time you, right? Like you go ahead and start filling it out and I'm going to clock in, and I can clock into our app in 4 seconds, roughly 5 seconds. So they can't write down the date, time, the service they're providing, their fob token, whatever else in that 4 or 5 seconds. It just doesn't happen. So here's a quicker and easier way for the PAs to be able to capture the information. We can get all the different data that's going to benefit the consumer down the road. We're going to be able to prove that there's higher needs there, that they need more authorization, that they need more time, because we've now got the data at our fingertips. And from that data is where it gets powerful, and we can do a lot of things with it.
Yeah, and lastly, I think from an FI perspective, like if you're thinking about this, like, oh, how are we going to implement this new thing? I think as John alluded to, like it's already for all of us up here on the panel, like that's already a built-in functionality. It's like you flip the switch and it's there. So if we get to that point, it's not another headache and it's not another implementation and it's not a go
device.
shop. Yeah, it's very easy to implement. And I think that's something it can be exciting. And I know not everyone's thrilled about collecting more information, but it can eventually, the goal is to help the end person receiving the care, and that's the consumer, and that's the whole goal of it.
And I
Looks like-
have one
think
more.
Tony has a
One
question.
second, Tony. I've got one more, and then we intentionally left a ton of time because we anticipated a bunch of questions. So I want to kind of take this. We've had 3 questions that kind of are kind of up at the macro level, kind of a theoretical / best practices. I want to kind of dive a little into the micro aspect of this a little bit, and it's because it's one of the most common questions I get from members. So I want an answer. I'm being selfish. Inevitably, there's PAs who forget to log in or out of an EVV system. It creates exceptions on the back end. It creates more work, and in some instances, larger disruptions because all of a sudden somebody was working for 3 days, and that clearly wasn't the case. And billing, well, if you don't catch it right away, billing might get declined because now you've got multiple people working at the same time. And there's just still consumers and PAs who refuse to use the system for whatever reason. But FIs are in a weird spot. They can't fire or sanction PAs under DOH rules and regulations. They can't withhold pay under DOL regulations. So wondering, in your experience, how are these situations and exceptions best handled? And also, do you have any insight on what the Fed's DOH or the OMIG will be holding up as an acceptable exception rate? And Brian, you get the privileges this time.
Perfect. So, for the state of New York, no, we haven't heard what their exception rate's going to be. What we've kind of heard mumbled about nationally in other states is that 70 to 80%, that you expect, 70 to 80% to be compliant. Look, you're going to have issues with folks forgetting to clock out, not clocking in and out. I mean, it happens. We're humans. Those are just part of the, what's going to happen. So you have to take that into account. You're also going to have those folks that just refuse. I have one consumer that I was talking to 2 weeks ago that they're in their 80s and their aide is in their 70s. Guess what? They aren't using the app. They look at the smartphone and just shake their head. And so it's about having other methods as well that make sense. And as well as having easy ways for the PAs to go in and edit their time whenever, they goof up and forget to clock out, or if they forget to punch at all, and then having easy ways for those edits to happen. That's kind of the first one that I see, as well as a business, trying to get the maximum utilization that you can on the system so that when those mistakes happen, when those errors happen, or those folks that you know just aren't going to do it, you have a buffer built in. That's the best I can say for it.
Yeah, I think when it comes to the exception rate, I don't know if we'll get to the point, maybe eventually, where there's some type of withholding on claims for certain exception rates. But I think the point is that they want to see the majority of people with compliant EVV visits. And then secondly, if you do have a high number of exceptions, it needs to be defensible. So they need to be able to audit you and find those reasons why things were, not compliant, when the edits were made, who made the edit, all of those things they're going to look for. And they may still pay on that claim, but they need to be able to see why that occurred. If you're 70 or 80% exceptions, that's going to be a problem.
Yeah, absolutely.
But yeah, I think really just being able to meet people where they are. And, I think from a federal standpoint, they're like, well, refusal of EVV is not acceptable, but what's the repercussion, right?
Yeah.
Like when you get into state regs, then it's like, you can't actually enforce that. So what's the right move? And I think you kind of have to press on that, and you have to going back to the pros of the system, you have to go back to that and kind of have your internal champion that's selling it like, hey, look, this is how we're doing it now. It's going to make the whole payroll process easier. It's going to be a lighter load on your FI, and not that they always care about helping out the FI, but I think generally they do. And so, it's about meeting people where they are. And obviously you want to get the highest adoption rate that you can get.
In regards to an allowable exception rate, we don't know what it will be, but I can feel pretty strongly, given our experience in other markets, that it'll be tiered over time. So it'll start at X, then after 30 days move to Y, another 30 days move to Z, and it'll kind of tier its way up to a level, right? Now, given that New York has not given any guidance over, a year into this thing, maybe they will just start with one high level and say, go at it. But I suspect that in most reasonable situations, you start lower and work your way up to kind of emphasize the gradual nature of the compliance. And then in regards to exception management, it is better to have a timestamp that's 7 hours late that you edit back down to an appropriate time based upon communications with the caregiver or the consumer than it is to not have it at all. DOH and General Dynamics will accept a timestamp that's been edited. So that's the statement, right? They will accept it that's been edited, but they won't accept it if it doesn't exist at all. So take it late and edit it down or up, whatever it needs to be, as opposed to not having it at all. So don't encourage, I was late, so I didn't do it. Encourage, I was late, so I did it anyway, but please understand that it was wrong and here's what it should be. And then the other thing about exceptions is OMIG has a defined list of reasons why you should have an exception for EVV. It's specific. It's not arguable, right? They have them. So ensure that when you're collecting an exception, you're using an OMIG mandated reason as the underpinning for why you did not collect EVV. One of the more interesting things that they did in regards to those reasons, I forget the timing of this, it was maybe 3-4 months ago, they released a statement that said, we're adding a new reason. And it's along the lines of, this is a CDPAP case, which I thought was very curious and undermining in a lot of ways to the whole progress of EVV. But they said, if you don't collect it, you can use this OMIG reason that excuses it because it's a CDPAP case. I don't know if anyone else thought that was odd, but to me it was. But that exists. I don't recommend you use it if you don't have to, but that exists out there. So
another fun thing is sending the reasons through the state aggregator, and then different reason codes for our friends at HHA. So it can get a little bit confusing. So, making sure that you have a vendor that can handle all the different sides of being compliant.
Totally agree.
And so, as I said, we left a good amount of time for questions. We knew, this is something that I get lots of questions on constantly and often don't have the answers. So it's something where we have 3 experts here, and so wanted to open the floor. I will ask folks, we're going to take one question at a time. If we go through and there's no more questions and you have more, we will come back. But for right now, we're going to cap folks at a question and we'll come back if we have more time. So, Tony, you were raising your hand before, so I'll start with you.
So it's not really the appropriate platform right now to debate over I think, main reason why they wanted to do EVV was to prevent fraud and proper documentation. Certainly in a self-directed model, what I read at the beginning and when it was put out that the purpose was, you have a supervisor, the nurse, the case manager of a licensed agency who's miles away of the home where the service is being rendered. And they want some assurance that, the person is there and functioning and putting the tasks at the end of the day and so forth. So there's some comfort level that when the person punches in, the supervisor who's not present on premises at the time of the punch or the time at the end of the punch has some comfort that the person was there and provided some services. Certainly in a self-directed model where there's a self-directed individual, I'm not talking about a designated rep that may not be in the house, but in a self-directed model, the supervisor is in the home. I mean, again, it's not the platform. So I don't, in my CPA certified fraud examiner experience, I have more comfort where a self-directed individual signs a paper timesheet or electronic timesheet where it doesn't have to be done, contemporaneous at the time of the punch in and the time of the punch out. I feel that there's much more comfort and the whole purpose here isn't to be 100%. It's reducing the risk, just like internal control. It's reducing the risk that anything that's material. So you can't get 100%. But in my mind, I feel more comfort that at a higher level, that someone who's in the home, self-directed individual, signing a paper timesheet or an electronic timesheet, as we know some of you have, to me provides more comfort than, let's be honest, someone calling in on a cell phone. Does that give you, me, anyone, HHS, CMS, whatever, any comfort that that service was done? Absolutely not. Absolutely not. And so, so the question is this. The question is this. Is there ever been any conversations that in the self-directed world, and maybe obviously you'd have to know this at a federal level because the states can't make any modifications to the act. But has there been any conversation at the federal level that in the self-directed model, maybe there could be some changes, maybe there could be, we hear Cures Act 2.1 or 1.2 or it's whatever coming down the road. Have you heard of anything where in a self-directed model where the self-directed individual is responsible for the care, that maybe there'll be more flexibility, or have you heard anything?
I haven't.
No.
No, unfortunately.
Yeah, I think a couple of fights have been brought on that, but I haven't seen any movement on that. And I think at one point, if any of you are familiar with the applied self-direction group, I think they brought that to the federal level, and they did not provide any movement on that. But I agree. I mean, I think if you're double verifying and you're signing off, and that should be an alternate method. So that's a fight that has to be brought way above my pay grade.
Do we have other questions? I will tell people who are watching online, I am monitoring the Zoom chat, the Q&A, the session chat. So if you want to ask a question, please put it in there. Anyone else in the room have questions?
So I have one quick follow-up to Tony's question and then my own question. So with the consumers being, go ahead. Oh, then I'm not going to follow up on Tony's. Okay. So with the parameters in place to all the exceptions that are happening, I know I talked to at least one of you yesterday. We're in the process of looking at a new EVV system. We currently have a system that was built in-house. What kind of controls do you have in place to make sure that a PA does not go over time, over authorized hours, that would really keep them in a more controlled environment that would then lend itself to EVV when they do start comparing it to claims?
So one thing that we encourage and a lot of the FIs that we work with do is they put a baseline schedule that they can all kind of agree upon. It's not written in stone. We know that scheduling is a bit of a faux pas in the consumer directed model, but they do find that it's best to have something on a calendar because, you know, EVV on the agency LIXA model is really a comparison, right? It's a comparison between a schedule, which is a thing that I'm not sure is going to occur, against what's actually occurring. And so if you don't have that thing on paper to compare against, I think you're at a disadvantage because it gives you kind of a starting point to know where, all right, this typically happens at this time and it's not happening. Let me make sure it is happening by putting a phone call in. It's a missed in, right? Or it's supposed to end at this time and it hasn't ended at this time. And if it doesn't end at this time, they're going to go over their authorized hours. And now we've got a missed out. So while it's not strict guardrails, we feel it does help put some controls in place to make it a little more organized.
Yeah, and from our perspective, we build in like alerts and utilization reports and all of those things, and even give the consumers the power to view their authorizations and see where they're at as far as those go. But where we kind of step in front of the line and don't cross is blocking the PA from like ending their shift early, because that puts us in a weird DOL position as well as you all. So unfortunately, like in a perfect world, it'd be great to just like have everything all cut and dry, and that's great. We give tools in order to kind of manage that, and then the consumer, obviously, you know, directing their own care, is able to see that and manage it as well. And sometimes may come to an agreement with their PA, like, hey, you shouldn't have gone the extra 15 minutes. Oh yeah, I'm sorry. We'll work that out internally, and they can do that. So we just give them the tools to do that, but there's alerts and reports and all kinds of things that you can pull. But unfortunately, we're just not at a place where, you know, we're comfortable kind of really cutting someone off at the knees on that.
So with our system, we have, you know, the scheduling features, we have the alerts and notifications. We also have enforceable daily, weekly, monthly authorization limits. We have enforceable time that folks can be scheduled. So if someone's supposed to work 20 hours a week, that's what, you know, when you start approaching that, you can provide alerts to the, you know, FI, to the consumer, that those things are happening. And so it's really important to be able to have not just the reportable features, not just scheduling, but also ways to enforce those limits, because frankly, as an FI, you're not going to be able to get paid for someone working 60 hours over this week, right? So you need to have a way to hold some structure there, and use it as training moments, right? So, hey, we see that you went over, we need to talk about that, and talk to your consumer, talk to their PA, and be able to understand what's going on. With our rules and our enforcement, you can set it up as soft or hard stops. So do you want to cut them off at the knees? You can. Do you want to have it a soft stop that you can then, your staff at the FI can review and use as educational moments? We have all of that available for you.
So I'd like to talk about community versus home. Because I think we're all trying to figure out what is going to be okay with the feds or the OMIG or DOH, and we're trying to determine, and I've reached out to other FIs because I don't know if there's a definition. If there is, please explain it to me. But you know, one of the criteria is location. And this, I think at CMS, it said, well, okay, we got a lot of people complaining about privacy, and we, you know, GPS, people don't want to know exactly where they are. So you could say home or community. Our issue though is what is going to be acceptable and what, if it is community, what is the FI responsibility to document, verify? Meaning, is it just okay that the field has a GPS location, an address? Do we have to, in fact, I brought this up when Applied Self-Direction had their Chicago, I think it was several years ago with all the vendors. And I remember CMS was on the screen and they basically, I said, well, what is our responsibility as FI? I mean, to be honest with you, if the GPS location is 20 miles away from the home, the fact that it's there, is that okay? Do you need us to verify that call the consumer up and say to the consumer, were you with this person? What is our responsibility? And of course, CMS didn't have an answer. They said, well, every state we're going to give the states, basically, ask the state. We're going to give them the flexibility. But now we're here. We're in 2021. And we are trying to determine what is acceptable. I've talked to different FIs. They said, oh, home is within 100 feet of the GPS location for that home. Anything beyond that is community. And we said, well, okay, then what do you do when it does fall in their community? Can you expand that 100 feet? Can you use a mile? If that's the case, is that okay? But I do know that some of the EVV systems out there require the FI to, if it is community, to put a location or an address or something to confirm that was okay. That's a real problem for us. And one of the reasons why we really haven't fully implemented the mobile app, because if we do define it, we don't think we could define with the mobile app a mile or 2 miles, because I think Omeg's gonna have a problem with that. If we do something very short, like 100 feet or 200 feet, if that then requires us to have that community punch accepted, means we may have to put in an address, means follow up consumer. It's going to be tough. So what are all of your thoughts about for an FI regarding community? What is acceptable? What is the range? What is the documentation follow up that you think we would need to do so that it would be okay with Omeg and DOH and CMS? It's a lot, but that's what that's really a problem that we're having.
Yeah, it's an excellent question. It was the single most confusing aspects of the aggregation model. Right? Everyone was fine with send the Medicaid ID, send the FI's NPI, send the first and last name, start and stop time. Right? Those are the fundamental aspects of the Cures Act. But then you get down to H or C or home and community. Everyone's like, what? What are you talking about? Online, if you look at DOH, the FAQs are very unsatisfactory. I think it's just something like community is anything outside of what's commonly referred to as the home. So it's a non-answer, right? But again, I think EVV, what it was intended to do was compare what a responsible party like the FI believes to be the location where services should be rendered against where they're actually rendered. And it's within this comparison that you can kind of arrive at legitimacy. So to your point, in our EV solution, we do require an address to be put in on the member's profile that kind of signals this is a valid location to receive services. And when the punch comes in, if it's at one of those acceptable locations, then we kind of allow the seamless EVV to go to the visit. I'm not sure if I'm answering your question or if we're just rambling here, Tony, but I think in the future, we are looking, there is no limit to where a consumer can receive services. So why do we have to do this comparison? We're kind of leaning towards the road of not requiring that, but we're not there yet. Yeah. Oh, yeah.
So with DCI, I mean, we have for EVV, for just straight EVV, as far as CMS goes, they just care about a geolocation. So we have to have a tag of where it happened, and that's all that we have to have for strict EVV. We also have the ability to enable geolocations. So you can have predefined service locations if you want to use that. Could be home, could be community, and then you can geo fence based on that. So did it happen if they choose home, did it happen within a certain radius of the home? If it's outside of that, then it can go be flagged for review. But if they choose something else, or if they don't choose one, it's up to you on really how you set the system. And that's how DCI was designed, was to be flexible for the FI's needs. You know your rules for what you need to do, here. So you need to configure the system to meet the rules that you need, whether it be for the city, for upstate, for multiple states, wherever you're at.
Yeah, and I think at one point there was kind of a gray area ploy toward the language that spoke about community. Like it was like, oh, is this like free for all space? Like if it's all in the community, then do we have to do EVV? I think a best practice would be to, and we do, like with the mobile app, for example, if that happens at not one of the specified locations, then we do mark that. You can mark it as community, and we do collect the GPS location if available. But there are options to kind of make it, an exception, and that's kind of up to the FI as a policy standpoint of like what we're going to have as an acceptable rate. And honestly, from an auditor's perspective, it's kind of like, if that happens, once a week because they go to a community center or whatever, like they don't have to know the exact business of where they're going and what they're doing. But if they see it's like EVV, the whole way through, and then there's like one at the community center, and it's like every week recurring or something, whatever it is, that wouldn't signal in my mind, in an auditor's perspective, of this is an exception problem. And so I think you kind of have to make a policy and judgment call on something like that. And, to his point, it's all in the configuration and what you're willing to accept.
So I'll give this back. If there's any other questions, folks, just raise your hand. I'll bring over the mic. I've known Tony for 11 years. He will just keep it the whole time if I give it to him.
Just as a follow-up, I'm trying to find a solution. I think, and we're probably pretty well there. Would it be possible? I mean, my concern is we Concepts, I don't know about everyone else, has a very mobile, if that's the case. We have people up here today, not only Concepts, but there's a lot of us that are consumers who are not at their homes today, and their shifts start and end not in the homes, and we have quite a few consumers with that. And we don't, I think what I'm trying to say is we don't want to start to get into doing all these follow-ups and okay, it's not at home, it's in community. I guess the one way of doing it is contacting consumer and say, listen, where was the punch started, and have them confirm it, and then us go in and verify it. I mean, could we, and I'm certain it can be done, could we, let's say, have a portal so that instead of us going in and calling the consumer up and verifying it, consumer's not home, we have to do a follow-up call. Instead of having to spend all the human resources, is it possible that maybe a portal could be created? I know, I know HHA and you and Jared, you have a portal. I'm assuming DCI has a portal. But could there be where that an alert goes to the consumer saying that there was a punch in a community, and just have the consumer go in and accept it? I would think that would be acceptable by DOH. So the call's there, the location is there, but instead of us reaching out to the consumer to verify that that community punch was okay.
Tony, can I jump in here real quick? Yeah. I guess my question would be, is the whole point of EVV is we're validating that the PA is with the consumer. So there should be no need for someone to sign off that they were there or not. If EVV happened and is approved by the system, no matter which system, we're validating that the PA and the consumer are together. And so whether it's the home or community. And so, it's the method that you use for that verification that happens. An alert going into the portal, absolutely. We have, multiple different ways. We can send a text to the consumer's phone to say, hey, you have a notification in the portal, log in and look at it. We can have them sign off on entries there. But I think you also need to think about what verification are you needing? Because we're already validating, any system you use that's up here. We're validating that PA and that consumer are together. That's the premise of EVV. Mm-hmm. Yeah. No, there's no FI intervention needed.
Yeah, yeah, and same with us. It's more of a policy decision. Do you want to be involved in that or not? And we can have that auto verified, and it
Yeah,
sounds like, yeah.
Exactly.
Yeah, so my question is, are there any like value add tools that the caregiver or the PA can benefit from for using EVV? Like, we're talking from a CDPAP world or with FIs where you just mentioned earlier, you know, if it's a CDPAP case, it's a perfectly acceptable exception. Or, you know, if a caregiver is, or a PA is living with the patient, they technically don't need to clock in. A timesheet is perfectly acceptable. So it's like, okay, we know the benefits that you guys are providing for agencies, right? It's more efficient. You're doing payroll more accurately. But like going back to your analogy, which I liked, you know, you force someone to eat ice cream, they're going to kind of push back. But if you kind of allow them to, you know, they're going to dig in. And like, so for a PA, you're not really, you know, what benefits are there for them to actually clock in and clock out? I think that would make it easier on the FIs if it was kind of clear as to what those benefits are.
Yeah, I'll jump in real quick because I think going back to the talk about like all the different tools and meeting people where they are, like if you're talking about a portal or something like that, where those punches are electronically collected and then available immediately. So as a PA, you can log in, you know exactly what your hours are for a given week, and you can kind of estimate your pay. You can, you know, it's like having that visibility immediately before, you know, before you were doing timesheets and sending it at the end of the week and all of that. But you have a platform to where you can view all of your timesheets. You can communicate, you know, with your consumer through it. You can work on schedules together between the two of you. I mean, it kind of depends on what you're looking for, but I do think that having that live data and be able to see things, you know, before it's like, oh, 3 weeks ago, I forgot about this one paper, you know, day I showed up in the afternoon for 2 hours. I forgot about that short shift that I did. Can we go throw that in? And it's like, you know, you can see it all on one page rather than, you know, flipping through all the timesheets.
It's the, you know, to the PA, you're going to get paid faster, more accurately. And now you know exactly what you're going to get paid because it's in your pocket on your mobile phone. Right. So that's the benefit there.
So yeah, I'm not trying to challenge you or anything. It's just like that. I feel like that's kind of a baseline expectation. Like my hours should be accurate. Like that shouldn't be a benefit saying, hey, my payroll is going to be accurate. You know, like, are there any things internally at your organizations that you're like, hey, this is how we're going to incentivize caregivers. This is how we're going to transform this industry. Like, you know, I don't think anyone would have thought, you know, people were going to have a career on Uber, right? Like people are using Uber and they have careers. Like why can't that? I know there's a bunch of compliance and regulatory stuff involved with caregiving or being a PA, but, you know, internally, are there conversations like, hey, how do we, you know, make this better for the caregiver? How do we make them, you know, have an opportunity to have a career or incentivized to go on the app, even if they're not clocking in?
Yeah. So we try to look at the app as not a tool for EVV, but a tool for employment. So we focus on communication. So when the caregiver engages with the app, not only can they do EVV, but they can chat with your back office, with your coordinator. We've got kind of this notion of a channel where if you have a general question, you kind of communicate back and someone picks it up. If you have a question about a problem in the home or a problem with the payroll, let's say, you can kind of ping it to the agency, they can respond. So it's not a tool for EVV, it's a tool for communication. Secondly, if we expose compliance information. So I know this is not heavily tracked in the CDPAP world, but if you want to know that you're due for an annual health assessment, or you're due for a flu vaccine, or you're due for a PPD or a drug screen or whatever it is, you can kind of sync that to the app. So giving them more to view and see there than just their EVV data. And then for things like COVID screening, you can kind of have that built into the app. So it gives them a reason to go there outside of EVV.
And I don't want to undermine the, you know, paying, seeing their time and it being accurate. It's not the accuracy point. It's that you can, as an FI, you're able to pay the caregivers faster and more seamlessly. We have an FI on the West Coast that's looking at daily pay. So imagine what, folks could do if you said, you can get paid daily, just like you do with Uber, just like you do with DoorDash. Frankly, most PAs are low paid, living paycheck to paycheck. So there are weeks that they're struggling. So how can you get them paid faster and more accurately without having to worry about it? So that's one of the big benefits.
Is there anything that you'd like to see
Yeah.
EVV do outside of EV tool do for your caregivers or your PAs? Yeah.
Yeah. Yep. Well, but you got to take it a step further. It's not going to the app to look at the compliance items. It's actively sending them, push notifications. And that's the whole key, is that you can't expect a PA to log into the app to go searching for something. Are they going to get a text on their phone that says your CPR and first aid is coming up due in 60 days and you need to go get it? And if you don't, when that expires, you can't clock in anymore. So you have to have that compliance piece, but you have to do the push notifications so that it gets in front of their faces, because, we all know PAs aren't going to clock into the app just to go look around and see what's happening and what may be coming up, right?
No one wakes up in the morning and is excited to bust into any of our systems, whether it's a PA or an FI. Like, they're not like, oh yay, like this is what I get to do today. So
Hey,
yeah.
speak for yourself.
So, I just wanted to kind of wrap one thing into what you were saying, and then I'm more than happy to let you have the last question. What I'm kind of hearing here and here is part of, like, going back to the overall title of this session, right? Like, getting the most out of your EVV system is communication, not just between the FI and the consumers, the FI and the PAs, but communication between the FI and your vendor. Hey, what can your system do? I would love it if your system could do this, and take things to your vendor and say, hey, can you make this happen? And if not, I'm going to go see if I can find someone who can. Because that's a customer service relationship too.
Totally agree.
And so a lot of that is going to them and saying, hey, I've got these ideas. I want to pay my workers daily, or I want to give them these list of resources that they can get in the app. Can we do all of this to kind of make this a system? And I think that goes to building that and getting that, iPhone or phone, $1,000 flagship phone that you're not nearly using $400 worth of the stuff that it can actually do, right? Like, we all buy this $1,200 phone and use a camera. So, that conversation is a critical part of that. And that's the only thing I wanted to weigh in. I'll give you the mic for, I think, what weighs in on the last question here.
Yeah. And going along to what Brian said, is these systems can't be built in a vacuum. Any of us need your input, need to know what can we enhance to bring value. Because frankly, EVV, there's 100 systems out there that can do EVV. I mean, there's cell phone companies doing EVV, but it's where's the value add that can come into to bring the system to make the FI more, efficient, to bring your cost of labor down, and what can we do to enhance it for the consumer and the PA? Because if you aren't doing that, there is no reason to have the system.
Yeah, definitely. And I think what Brian said was really interesting, how opening up a conversation with FIs or any agents, any customer, and getting feedback from them is really important, because, a lot of systems, they're very just, this is how it works. This is, you either play by the rules or you don't. And I think in this industry where it's kind of evolving and EVV is new, it's important to have those conversations. And we have an EVV system, right? So, and we talk to our customers, and like, one of the biggest things was, how do we incentivize the caregivers? And if you look at other new apps that are coming out, like across the board, I mean, look at, Robinhood, people can invest, right? And the problem that it was so easy to invest money, whereas before it wasn't. And one of the things that Robinhood perfected was gamifying the app, so it's like you go on the app and you can throw $100 into a stock and it feels like a game. And it's like addicting. You don't even realize you spent the $100. So for us, what we've done, and after surveying our customers, is like, okay, well, how can we help gamify the app to incentivize the caregivers to clock in? Well, if they clock in successfully for the full week, they get a bonus. Or if they clock in, for the full month, they get an employee of the month, whatever it is. That's what I was kind of asking originally with my question. I know what everyone can do right now, but what are the conversations internally that you're having with customers and also with your research and development teams? Like, this is what we're going to try and implement to make EVV easier, or to just totally transform, how it is, as opposed to just saying, hey, caregiver, here's a new way to clock in, clock out. You have to do it. Whereas, unfortunately, you have a lot of FIs that are saying, I don't need to force my caregivers to do it. I don't need to do that, because CDPAP is a perfectly good exception, which we've seen from OMIG or from whatever. And, and then a lot of the F agencies saying, hey, the PA lives with the client. We don't need to do it. And they don't need the headache. So it's really about incentivizing the PAs. Anyway, thank you.
Thank you. And I will say, Brian, Jared, John, thank you very much. For me, this has been very enlightening. I know I'm going to actually have some answers to some questions that people ask me now, which is fantastic. That's always a bonus. I hope all of you got something out of this. The key takeaway I had, I think across the board, this whole thing, this rollout, the continued evolution is about communication. It's about communication with your consumers. It's about communication with the consumers' PAs. It's about helping your consumers communicate with their PAs. And it's about communicating with the vendors. And when we communicate, just like any other facet of life, things are better. And so hopefully, like I said, hopefully we all took something away from this. As I said, I know I did. I very much appreciate all of your time and willingness to be here and offer your expertise on this topic. It continues to be one that is raising questions for our membership. I'm sure it's raising questions for others. And thank you very much.
Thank you.
For having us.
Thank you.